What's good?
Good
How you doing?
afternoon to we thank God. It's another day He's given us, so let's see. Um, okay. So today it's Thursday, just as our culture and our custom is, we'll have to look at public health. This should be lecture 3. Okay. So we are going to look at public health and health promotion. So we are graduating, small, we are moving. Small, we are moving. And just as we've been doing for anatomy, physiology, and then pathology, we are also going to do same for public health and health promotion. We are graduating. And by the time we are finishing our course, you are going to see how the linkages within the various topics come together to make sense of all that we are studying. Okay. Finally, everything will begin to make sense when we are able to interconnect all the topics together, and then the picture of the reason why we are studying each course in this program would be achieved. Okay, so that is how it is. Today we are going to focus on 3 areas. We are going to focus on 3 areas. The first is to be able to define environmental medicine. We are going to define environmental medicine. Okay. Secondly, we are going to seek to explain the focus of environmental medicine. We are going to explain the focus of environmental medicine. Then finally, we shall seek to describe environmental factors that are associated with disease causation. Okay, so these are the 3 areas. You know that public health, because we look at health in a population, health in a group of individuals, okay, or health in a particular territory. We can't I mean take away environmental medicine from public health, okay, because we all live in the environment, and one way or the other we are all impacted by the environment in which we live. Okay, so we are going to look at environmental medicine for today, and as we progress we shall connect all the dots so that we can really understand what we are doing. Okay, so let's move. Today we may finish quite early, I'm sure. So let's see. But before that, so far what we have studied, is there anything anyone wants us to know? Question, suggestion, contribution? Is there anything any one of you wants us to know before we can get into the lecture proper? If there's anything, it can come up. Okay. Okay. So yes, Mr. Pia.
Yes, sir. Yeah, I wanted in the lecture too. It seems I was glancing through and the area regarding public health in relation to helping for road accident to reduce and road safety, not road accident specifically, road safety to reduce. I wanted you to throw more light on that area in terms of understanding of how public health would be able to contribute to road safety.
Okay. Yes. So yes, you are right. You know, um, public health is quite broad. Okay, and um, it's more like um, what are we looking at in our environment or in our territory that has the tendency to cause disease or bring ill health, okay, or cause ill health or bring ill health. So we we looked at the environment and we realized that, or public health specialists looked at the environment and realized that our lungs are receptive to some particular molecules of air. Okay, so the component of air, there are some particular molecules when they get into our lungs, there are no problem. But when they happen to be anything in addition to these, then our bodies react, especially when we inhale them. Okay, so when we entered into the industrial revolution, now we have factories coming up, we have cars, we have a lot of machines that are coming up, and these are applied on our roads. Okay, so you are on the road, I am on the road. If we don't check the monoxide gases that some of these machines, some of these vehicles are emitting, at the end of the day, we are all going to suffer. Okay, so public health had an eye on our route as well, because we are looking at the environment in totality. So we had an eye on our roads and realized that some of the fumes that are coming, they are not good for our health. Okay, so we have to do something about it. And by and by, there was a ban. Okay, policy was designed to ban cars that are emitting a lot of fumes, okay, that are detrimental to our health. Okay, so as time went on, a lot of designs in the car, I mean, modern designs were coming up. Today we have entered into an age where we are shifting to electrical cars and all of them. Okay, all because of these greenhouse gases. Okay, so public health saw the need to get individuals in total health, and you saw that one of the things in our territories, in our environment, on our roads that are impacting us is the 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 fumes from cars. Okay, so that is how come the MTTDs came in and all this. That that even there can be noise pollution. The cars, sometimes the horns, that is not easy. So all of these are noise pollution. Once it gets into your ears, it disturbs you a lot. You may even be thinking about something else. Okay, then these things will come up. So that's the reason why public health came in. Okay, our sister is also saying yes. Our vicinities, our gutters. Okay, our gutters, the way we bend things, rough in our vicinities, and all of them. These are not unhealthy. These are unhealthy for us. Okay, and that's how come they introduce a policy framework, the public health um, that deals with health policy. Okay, they will design and then get authorities to approve. In this case, Parliament will approve, and then it becomes a law. If you break, it is punishable in this country. So that is how it was. Okay, that is how it was, and it has come to be. Okay, any more? All right, that's great. So we can now proceed. Today we are looking at the environment. Okay, the environment. So let's begin. What is environmental medicine? What is environmental medicine? We are saying that the term environmental medicine refers to diagnosing and caring for the people exposed to chemicals and physical hazards in their homes, communities, and workplaces through such media as contaminated soil, water, and then air. In Ghana here, then now we have problem. So when we care for persons, okay, who have been exposed to agents in our environment, either coming from contaminated soil, contaminated water, or impure air, okay, it becomes hazardous to the body and therefore it can impede or cause disease. So, in caring for them, we have to really, really look at a lot of things. Interestingly, mainstream medicine, okay, let me not implicate myself. Let me just go. So that is how it is. Okay. So as naturopaths, uh, one of our principles in anything is to be able to trace, the disease, okay, to its origin, trace the disease to its origin, and then you you try and then what you try and then solve it like that. So you you test for your patient, you do your metabolomics, okay, you do your metabolomics, and then you come to realize that uh, what is metabolomics? I know we know what is it. What is the especially practitioners? What is it? Okay, so um, it's the 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 findings. Okay, the findings. A lot of things are in our bodies. Uh, we test for. They are called metabolites. So these metabolites uh, gives us a clue on what is happening to our bodies. So those who use quantum analyzer, okay, quantum analyzer, those who use quantum analyzer, you will come to realize that there are some pages that you would see um heavy metals. Okay, you will see heavy metals. You will see lead, mercury, arsenic, and all of them. Okay, chromium and all of them. These are one part of the metabolomics findings. As we can also see amino acids. Okay, amino acids, the arginines and serines and all of them. So they give a clue on what is happening to the body. So, for example, when you are able to get um, after you being able to diagnose your case, and then you want to find out how to be able to solve the problem, how to be able to treat the person, okay, in totality, holistically, then you have to trace some of these things to their origin. So imagine you are able to trace it to maybe a contamination through the soil. Okay, contamination through the soil. Then even though you are detoxifying or you are replacing metabolite, you also cancel on what the person can do. Okay, what the person can do so that it doesn't come into contact with the origin of the disease. Okay, so that is what it means. So environmental medicine is incorporated into our work also. It's incorporated into our work. It is not always that the person comes. Your focus shouldn't always be that the person brings a disease and then you give medicine to treat. Person brings a disease, you give medicine to treat. Okay. Sometimes you have to go to the next stage by helping the person to know what the person does, and then this problem comes about. Okay. So that is how it is. So in environmental medicine, in environmental medicine, our areas of focus are these. Okay, we can focus on these. These are some of them. Okay, so we can focus on children's environmental health. Children's environmental health. Okay, you can focus on climate change. You can focus on climate change. You can focus on healthy community design. Healthy community design. You can also focus on lead toxicity or lead poison. Okay. And then you can also focus on preventing chemical exposure. How can persons try so that they are not overly exposed to um, hazardous chemicals? Okay. So that is it for environmental medicine. Now let's go to, yes, another. Okay. So let's look at them one by one and see. So we are going to child environmental health. Child environmental health. Okay, so children children and the environment. It's like one and two. So we say it's young children. Young children often are hardest hit by consequences of poor environmental public health systems. This is undoubted. Okay, so for their size, they breathe more air and eat more food than adults. Okay, making them particularly vulnerable to environmental public health hazards. So as for children, every time, anything they get, anytime they are putting in their mouth. Okay, it's unlike humans. It's not like adults. Sorry, it's not like adult. Okay, so sometimes you can even see that low levels of toxic exposures, okay, can affect children's physical and mental development, even at the low levels. Okay, even at the low levels, children can be affected. Okay, so we can take a special focus on the child's environmental health. So you see that public health is quite broad. Okay, public health is quite broad. So persons who are taking up public health as a course or as a program, they go and then they can specialize like that. Okay, a lot of specialty areas are there for them. Now let's look at climate change. Let's look at climate change. You know that these days everywhere the world is talking about climate change. This year, I don't know if I've ever witnessed it before. I can't remember. Yes. So what Europeans give us? Interestingly, the United Nations, Africans are part of it. It's just that we do not really have math. Okay, we do not really have math. I understand that. I don't know if it's an old story. I understand that US has. Oh, that's fine. So, oh, okay, I see. Mm. I understand that US has withdrawn himself from WHO or UN. I don't even know whether the story is even accurate, but that is how it is. Once they do that, they try to disturb a lot because they have the money, and you are going to beg. Africa, we go and beg, and they have the money, so they tell you what to do. Okay, so that is what is happening. That is what is happening. Um, yeah. So climate change, just as I was saying, this year it was raining in January. It was raining in late December. Well, I don't know if I've seen some ever since I came on this planet. So maybe this is my first time, or maybe I was a child, an infant, so I couldn't take recognizance of that. But this is what is happening. We know that June, July is rainy season, but these days, October, November, December, it is raining. Okay, so times have changed, and these are climate change issues. These are climate change issues. So environmental medicine can focus on climate change. So you see, you take up a course in public health, perhaps at the master's level, you focus on environmental medicine, and maybe at your doctorate level, you now specialize in climate change. Okay, that's how it is. So it's quite broad. It's quite broad. So what is climate change? It says we from exposure to extreme weather and heat waves to worsen air pollution and the spread of insect-borne disease. Climate change is a health emergency. Okay. Now climate change, it is a health emergency. These days, the heat we are facing these days is not easy. So you are even in air condition and you still feel like, I mean, you take your hanky and then you are cleaning yourself. It's not easy. Okay. So it is a health emergency. No two ways about that. In fact, I was told, someone told me that, which country cry did she go? She told me that when you are in your car, when you are in, yes, Harry, when you are in your car, I'm coming, 1 minute. Okay, sorry. So, so these days, it is obvious that climate change has become a health emergency everywhere, everywhere. Okay, so just as I was saying, there was a lady who went to one of these countries, I think Central African country or East African country, and she says that you are in your car in air condition, and if the way the sun is scorching, it feels like there's no air conditioning in the car. Okay, it feels like there's no air conditioning in the car. So that is what we are facing, and it is getting out of hands. Okay, everywhere in the world they are trying to get solutions to it, but we are patiently waiting to see if there can be any solution to it. Okay, so it's a climate change may result in changed disease patterns, okay, making communities susceptible to different illnesses. Yes, that is undoubted. Okay, now the changes in the climate contribute to some of the diseases that we see. Okay, when the weather is extremely cold, there are diseases that may pop up. when the weather is extremely hot, there are diseases that we can be susceptible to. So that is how climate change is, and that is how serious it is. It has health implications. It has health implications. And additionally, we say climate change has been linked to an uptick in floods, wildfires, and superstorms, all of which can play profound roles in harming human health. Okay, so that's what it is. Nowadays, from the videos we see, when snow is coming. It can come and come and come and come. When the sun is scorching hard. Okay. When wind is passing, you no longer enjoy it again because the way it will blow, you'll be scared. So everything is changing. Everything is changing. It's just as Paul will say, the earth itself is groaning. Okay, the earth itself is groaning. We'll see a penny, okay, waiting for deliverance. So that is how it is. That is how it is. So yes. So this is chairman, Chairman Tipu Tipu. So this is Chairman Tipu Tipu trying to tell us what climate change can do. Okay, what climate change can do. So when it is not the sun is scorching at a very high intensity, you know that it's going to be problem. It is even going to affect our food production. Okay, from the agriculturist, it is going to affect our food production. Okay, so heat related, infectious disease on the rise. There's going to be challenges in water quality. Okay, mental health issues are going to rise, and then respiratory, this one. All these as a result of what, climate change. Okay, nowadays I see world leaders talking about climate change. They really talk about climate change. So we are waiting to see how the whole thing goes. So we are saying that it's not only important to strive for optimal environmental health, it's also beneficial for both individuals and for the surrounding communities. Okay, so these are some of the benefits: cleaner air quality, increased access to healthy foods, improved health equity, cleaner water, okay, safer outdoor environment for adults and children, reduce hazardous waste, and then improved population health. Okay, so I know we have Ghanaians, we have Nigerians here, we have South Americans here, we have, yeah. So amongst this, okay, let's start from the Ghanaians. Among this, okay, 8 things we've talked about: clean air, increased access to healthy foods, improved health equity, cleaner water, and all. Which ones um are readily available in Ghana here? Which which of them do we not have problem with? Which of them do we not have problem as far as these things are concerned? Let me hear your views. If you have any view, which of these one, two, three, four, five, six, seven? Okay, these 7 items. Can you say that as for Ghana, for this one, we are okay? But for this one, or this one, we are not okay. And then try and give us reasons as to why you say it that way. Anyone to try? Anyone to try? Or we are still thinking about it? Okay, madam. Yeah.
I am not from Ghana, but while we wait, I can say for Belize that we have cleaner air quality, We have good air quality. For the most part, our water supply, at least 80–90% of our population has access to clean water, maybe more. Increased access to healthy food, no. There is healthy food access is I would say 70% of the population has access to healthy food. Improve health equity, again, that's fairly high. I would put that at about 85%, because we recently are outsourcing um, we're rolling out, sorry, a national health insurance in other parts of the country, so it will be countrywide. Safe outdoor environment for adults and children in the rural areas mostly, but in the urban, I would say no, because of the violence and traffic and the congestion that's in the urban areas. Um, Reduce hazardous waste. We have a very good solid waste management policy. So that is in order. Our public health is quite good with that. So improve population health. Overall, it has increased, it has improved over the past few years because we focus on the sustainable development goals and try to comply with those. All right, thank you so much.
Okay, thank you. Forgive me to ask, Belize is on which continent?
Belize is in Central America,
Okay.
just below, we're between Mexico and Guatemala on the Caribbean coast or the Atlantic coast.
Oh, okay. Okay.
Mainland, yes.
Okay.
The
I'll one day
island
come
of Jamaica. Jamaica is an island to our east of us.
Okay.
Yes,
Oh, that's great.
yes.
Okay, my hand is up.
Yes, I'll one day come there. Yeah, Madam Teresa.
Yeah, I'm thinking that in Ghana, right now, environmental change, we are having this galamsey destroying our water bodies that are entering our food and then the water system. But we don't have the hurricanes in Ghana, and we don't have the bushfires now in Ghana because of the way the rains are coming. So that is what I have to share.
Okay. So it means we on the scale of 1 to 10, we may not be able to cross 5 for cleaner water. Or what will be your score for cleaner water in Ghana?
Cleaner water in Ghana, I don't have any better score for it.
I see. That's interesting. That's interesting. Okay.
Okay.
Thank you.
So please,
Yeah,
can
Mr.
I?
Emmanuel. Yes.
Okay. Okay. So I will start with the cleaner air quality. Okay. So for that, looking at how green Ghana is, I can say for most places, but it also depends on where you stay. For those of us who have stayed in places like, I stayed there. So the place I can't mention is where I stayed, where I lived my life. Where almost all the directions are going to give is gutter, boiler, toilet. And those kind of places, you may not have that cleaner air. But with where I am now as an adult, where I'm staying, the environment is much more greener. And when you travel outside the country, you see a lot of green. So for cleaner air quality, I can say we are doing very well. And also, I want to combine two things, improved population health and also improved quality health equity. Now, Ghana has had Ghana Health Insurance Scheme for a very long time. And that was the time that Ghana experienced much more improved population health and also improved health equity. And also the maternal care system that came in, and also with the Agenda 111 that also came, that was supposed to have a lot of facilities. Aside that, in Ghana, you wouldn't find a community without at least a chief's compound or a private health, it may even be a traditional health setting, but healthcare, access to healthcare is much more widespread in our country. So we have that. And also increase access to healthy food. Yes, because we do not have much more of the GMO stuff in Ghana here. So with our food, and if not for the menace of Galamsey now, would have really had very clean water and also would have also affected the health quality of our food. But for now, because of the way the gold mining and the way they are destroying our water bodies, you cannot say much about our healthy food and also our cleaner water system. But aside that, Ghana is really doing well. You can go out. There's a safer outdoor environment for a lot of people. These days, there are a lot of recreational sites that you can go to. So when it comes to environmental medicine, I think we are doing quite well. If not for these few, especially the Galamsey that is really destroying these two things. Aside that, Ghana is really a good country. And they're doing a lot of this environmental medicine. Thank you, sir.
Okay, thank you. Yes. Thanks for your views. For Ghana, the one thing is certain: the peace we enjoy. I mean, that is what I always pray, that politicians will maintain our peace for us. Whatever they want to do, they can do. But for our peace, they shouldn't touch it. Yeah. Pastor Henry. Yeah.
Yeah, good afternoon
Good
to you and then to our colleagues. I think when we talk about environmental medicine and then we relate it to Ghana, I think our problem has been our attitude. Our attitude hasn't helped us. So if our attitude were to be somehow, improved, good, we have a best country, a place where God has really endowed us with a lot of good things.
Yeah.
I always say this. I had the opportunity to travel to Vietnam, and there sometimes I sit in the room and I cry. Because when I remember our country, Ghana, my country, Ghana, where I had come from, and then look at the environment in Vietnam, look at how neat the places, even within communities where you have water bodies, were kept. I remember when we were young, I'm a Ghana from Accra, and then in just the Kole where used to be a place where they fish. We have this tilapia. All these things were there. Today, how is it like? We've destroyed everything. We can't get the tilapia anymore because we have dumped rubbish, and then we've destroyed that ecosystem, that ecology. Look at us. And when we're growing up, yes, we all went there to do something like that. And that's a nasty thing. I mean, it's not good. But all these things is our attitude. Our gutters, places when you are passing, in fact, you need not to look into the gutter. Because when you look into the gutter, what you see, you don't like it. There are places when you see a black quality or something, you don't, in fact, be very careful that you don't kick it. Because when you kick it, there's trouble. So it is about us. It's about us. If we change our attitude, I can tell you that Ghana is the best place that you can talk about because our the climate, and then you can talk about many things. Today we are talking about Galamsey. Where did it come from? Selfishness. Because of some people's selfish attitude. That's why we are facing all this. So all in all, we learn, and yet we don't really implement some of the things that we learn. And it's killing us. I hope that one day we all change our attitude and things will be fine. Thank you.
Okay, thank you. Yeah. So we are chopping some successes and then some to I remember about some years ago, when I go to the village and I'm coming to Accra, I feel like I'm entering into a cage, because the greens you experience and the clean air, and then when you are coming. But here is a case that you there in your village, the greens are there, the fresh air is there, everything is on point too. But you and poverty is a one and two. You are not far apart. So you there, and then poverty will be looking at you. You want to run to Accra to make life this one to, then you are coming to face it. It's not easy anywhere. Okay, but whatever it is, there are some successes nowadays for Ghana. Our headache has been water pollution caused by gold mining. In fact, that one, it is really a disaster awaiting us, and we are in real trouble. One research I saw, conducted by, I think I've forgotten the group that conducted it, that foodstuffs that are coming from these gold mining areas are contaminated with these heavy metals. Okay, lead, mercury, this one, and it's serious. In fact, it's serious. Okay, had it not been that, just as Pastor is saying, yes, it's our attitude, because this galamsey thing had been, even in 1800s, this galamsey was done, but our forefathers never spoiled any water until we realized that we can be greedy and then bring heavy duty, trucks come and spoil our water bodies. I was even asking one person that, is there a way that this thing can be done? And then said, oh, if you see the water has poured, it simply means someone has gone into the water. Okay, to they divert the water, try and then dig the sand inside and then go and wash, and then that is what causes the problem. So, oh, okay. So this is what is happening. Other than that, I can say, we've really made progress. Just as Mr. Emmanuel was saying, yes, Ghana health insurance, gone are the days that maternal mortality was skyrocketing. But along the way, public health concerns rose. They sat down with lawmakers, and then they came away with this strategy that, look, let's introduce something to take care of our women when they are going to give birth. And thankfully enough, it has come to help. Now even mainstream medicine, mainstream healthcare delivery, with health insurance, how much are you paying for the year? Less than 30 cedis. I don't even know, but less than 30 cedis. You renew your insurance. When you are sick, you go to the hospital, and then you are taken care of. Okay, you are taken care of. At least you can cover a lot of things. Some of the greedy health practitioners too are there. You go to the pharmacy for drugs, they will tell you they don't have. So you go and buy it outside. Then they will fetch it from this one and then put it in their bag and send it to their pharmacy. Okay. Well, that is what someone told me. The person's like, I'm also lying. This is an online environment. Okay, so that is how it is. Other than that, and I will see, say we've really done well compared to previous years. Okay. Yes, we have safer outdoor environment. For Ghana, they ask for peace. If you want peace, really want peace, come to Ghana. There are safer outdoor environment. Okay. There are safer outdoor environment where children can go and play, adults can go and play, and all of them. Okay. And then what else? Yes, population health. Now we have better comprehension of this one. It's only that lifestyle diseases is the one worrying us these days. Lifestyle diseases. And that one, yes, waste. Yes, the MMDs. Yes, the assemblies, they are paying a lot on waste. waste management. Waste management. There are countries that they say waste can turn to electricity. But Ghana here, waste, I don't know how we can manage. I don't know. Maybe one day we shall get there. I'm sure. Okay. So this is what is happening currently. Some are good, some are positive, and some too are negative. All right. So let's see. Let's look at healthy communities. Healthy communities. Okay. Some of the focus of environmental medicine is healthy community. And we say the way we design and build our communities affect our physical and mental health. That is true. Okay, when people can walk, bike, or roll where they need to go because of supportive infrastructure like connected, well-maintained sidewalks and bike-friendly routes, car traffic decreases, and that can improve our air quality, okay, and then respiratory health. That is true. So nowadays, I say as for this one, I don't know if it is Ghana, but I am sure it is everywhere. With when real estate people, I mean, took up upon themselves to be educated in the real estate area. Now we get environment well demarcated. I mean, you can see that it's unlike a place that I know that someone opened the window and then you'll be looking into someone's bedroom. Okay, so someone's bedroom and then someone's bedroom are attached, and the window is in between. So once you open, you are looking into someone's bedroom. Nowadays, it is not there. Slums are even decreasing these days. Okay, slums are even decreasing these days. It's because of our well-established settings, our environmental settings, and all of them. So we are making progress. We are really making progress. Okay, the only issue has to do with our gutters. Just as someone said, our gutters. Yeah, you know, I don't know if it is because we are not covering our gutters or our attitudes. I don't know. Just that we are unable to maintain our gutters cry. We are unable to do that, and it is really, really, really not helping. Okay. So we are saying that when children live in homes that do not contain lead or asthma triggers, they are better able to grow and develop in a healthy environment. Okay. So that is it. So some of the focus of environmental medicine is healthy communities. Healthy communities. Okay. There's a community in Ghana here. In fact, there are some people they really, really mean well for 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 where they stay. They really mean well. I've forgotten the town. I think it's in central region or western region in Ghana. The leaders, the chiefs there decided that they will, I mean, renovate the whole town. And I mean, they started planting grasses. I mean, in the town, they are started where they have to cement so that persons in wheelchair can move freely and they will not be staying indoors. And then all of them creating employment for. I mean, the way they have designed the town,
It is in the central region. I think Kushia.
okay,
I think
Kushia,
Kushia
Asin Kushia,
in the central region.
aha. You see, there are some people, how come? Why is it not the same brain that is in everyone? But, you know, they were able to think of something and they implemented it. And here we are. I think we can emulate this. Okay, we can emulate this. And then we can all live in an environment that we can all be happy with. In fact, when I heard one of the chiefs, he says they even planned of painting every town. Okay, painting every house in the town. Okay, and they did so. So imagine that you are from this town in the evening around 5, around 6, you stand somewhere and be looking at the that is even it is even better able to shape your mind well. Okay, you are able to think well, but sometimes where we live it becomes problem. Okay, it becomes a problem. So maybe when we are praying, we should pray that God will give us more leaders or leaders who are able to think like this. Okay, and then we'll be fine. And then we'll be fine. Okay, so another focus of environmental medicine is lead. You know that lead these days, lead has become something else. It has become something else. Okay, so it is a naturally occurring metal, as we know. Okay, and this is what is used in our batteries. Okay, our batteries and then our pipes, some of our pipes. Okay, so it has beneficial uses. Okay, but when I finish, you tell me. Wait, Madam beat you. When I finish, you tell me. Okay, so you know it has its own benefit. Oh, that's the same thing we use to power our cars or this one, but it can be toxic. It can be toxic. Okay, it can be very, very toxic. So we can be exposed to it. We can be exposed to lead by breathing contaminated air or dust, or drinking contaminated water, okay, or eating contaminated food. Okay, okay, okay. I think we share. You see, in fact, when you are, I mean, the way the grass is, the way the way have been paved, and this one, yes, in such a town, you are okay. But when you happen to find yourself that when you look left, someone have gone to do his own thing. When you look right, a dog has defecated here. When you look here, the gutter is choked. Then it becomes something else. Okay, so that is it. So we even in our paint, okay, even in our paint that we used to paint our rooms, it is problematic. I think this last year or 2 years, one TV station did a survey, should I say survey, an expose of how lead containing paint, okay, lead containing paint. In fact, the ones that have exceeded the threshold, okay, the one standard authority, it has exceeded their threshold. The way it has flooded our market, and people are buying and then painting their rooms. Very, very poisonous. So you stay in such a room, and then if you happen to be um, hypersensitive in your respiratory tract, then you are always going to get the trigger. You're always going to get a trigger. Okay, or maybe it begins to peel off, and then your children are there. And they are picking with their hands, and then they are licking their hands. It becomes something else. Okay, it becomes something else. So these are some of the things that environmental health would consider. Okay, and then so who is at risk of lead exposure? Who is at risk? I'm sure it is everyone. We are all at risk. Okay, children are at risk. Okay, children, you know that their hand always in their mouth, from floor to mouth, from floor to mouth, from floor to mouth. Every time they are at risk. Pregnant women, okay, are also at risk. Okay, you know that lead is things that can cross the placenta. Okay, it can cross the placenta. Okay, okay, wait, a video. Okay, when I finish, I'll watch. Okay, it can cross the placenta, and once it crosses the placenta, and then it may be disastrous to our children. So these days, you realize that you can give birth to a child, one kidney did not form well. You can give birth to a child, the brain is, I mean, in not in a better state. You can give birth to a child, and then because these heavy metals are able to cross the placenta, they are able to disrupt normal this one, and then you can have child coming with a fingers instead of five, coming with six, and then all of them. Okay, so it's something. So adults too are not exempted. Okay, nowadays our food and water. Now these are food and water. There was um an experiment that was done. I think about 3 or 4 years ago. I was speaking to a public health, this one at Kolebu Teaching Hospital, and the public health doctor told me that they took samples of every drinking water that we have. In fact, the ones that have names in Ghana, they took a sample of them to conduct heavy metal assessment. And the result was that only one was able to pass. Only one was able to pass. He declined to mention the name of the one that was able to pass. But what he said was that all the ones we know, which has names that we are saying, none of them passed. None of them passed. So there was later years. In fact, all that he told me was that if I want, I can bring samples to this one, and then when I bring the samples, he shall conduct this one, the experiment for me. That one is more appropriate than coming to mention a company's name. But I wasn't able to go. It was in later years that I saw an experiment online. This individual had come for samples of this water, and then it came out that only one was able to fairly come out. Okay, the rest were contaminated with heavy metals. So this is the situation. This is the situation we are facing now. I'll try and look for the video. I won't mention the company's name. These days, there are many lawyers in Ghana who are not getting work to do. So as soon as you say something, you are in trouble. By the time you realize you are going to build their house for them. Okay, so that is what is actually going on these days. Okay. Let's look at the risk. So when you are exposed to lead, some of the things we can see is a slowed growth. Okay. Then we have lower IQ. Okay. Lower IQ. There are learning difficulties. A lot of okay, so Madam Christiana.
Yes, please. Good afternoon.
Afternoon.
Please, my question is in relation to the kind of water we have in the system. It's very true that most of them aren't in a good shape for us to drink. But my problem is, are the authorities aware? And if yes, why would they allow such a thing to be circulating in the environment or in the system? And people are drinking, we are drinking and falling sick every single day. Is it intentional to create market for the mainstream? Thank you.
Okay. Are the authorities aware? Okay, so that one is subjective. It is possible they are aware. The reason why I'm saying this is that I remember in 2015 when I was doing my service in Kolebu, and our supervisor, we were going on ward rounds, and our supervisor told us that, cardio center, cardiothoracic center, when you go to Kolebu, you know the cardio, those who have been there, they know. They are getting a lot of heart diseases. And one of the research suggested that there is a product on the market. And that product, okay, it has been linked to the heart diseases that people are getting. And that product, I can't mention the name. Okay, it's just that you need only hot water. Okay, so when they said, look, the person who is at the forefront of this product is a very powerful person. So who is going to say? Okay. And this is the situation we find ourselves in. So there's a likelihood that it's possible, but who will say? Mr. Ambrose.
Yes, sir. Good afternoon, everyone.
Good afternoon.
Yeah, so I just want to add up to what you're saying. Mostly, I would say that the leadership or the authorities are aware, but this is what happens. You see, when they are taking the first samples to for the how do you call it, approval, they do it to the standard. After the approval, you know, Ghana, especially when you are purchasing something, the person goes all out, but the maintenance becomes a problem.
Yeah.
So the authorities focuses more in the person just coming to register, approval, bam, no routine checkup. Then that is when they know that, oh, now we've been approved. So they do the bola thing, inclusive. They just mix it up. So until a leak up or a chook is brought up, nobody follows up. But then also, because of money, most of them follow money. Because this thing that you were talking about before, for instance, when I take it, I like more or less, I am half paralyzed. I can't do any, when it enters me within the next 3-5 minutes, I can't lift my hand, I can't lift my body, I can't do anything. The one you say, you just need hot water. I know it. The moment it goes inside me, since it came, I've taken only 2. The first one I thought it wasn't it, so I had to take again. And since then, I have never gone close to it. When I see someone going close to it, I try to caution the person. And it's not just that. There are a lot of products in town that most of them, because of money, because just let's look at this chemicals that they are using for farm products. Is the authorities not aware? Myself and you, nobody in this class approves of that in Ghana by bringing them. They know. They allow it in, and later it harms us because when they are sick, they will go abroad for treatment. And our healthcare system is halfway not too good for us. So the poor will keep on to be poor and poor will keep on to die. Unlike the rich who can fly out there, for treatment. So when they go outside there, I notice that when they don't go to learn. They only go to the hospital for treatment and they come back. So excuse my language, they don't learn any sense there. They only go and treat themselves and come back. So when they come, they see us as stupid or whatever. They only attend to us when they need votes. Apart from that, they don't value us. But I thank God that now Ghanaians are waking up to know the reality. In the next 10 years, 5-10 years to come, there will be a big revolution that I believe things will change. But until then, thank you.
Yeah. So yes, that's great. And we pray that time comes. So that, now Ghana has been able to, do second cycle education free. We hope that it will continue so that critical thinkers will now come and then be seeing things. Yeah. Pastor Henry, your hand is up.
Yeah.
Yes, sir.
What I want to say is like in Ghana, we have this that we say, the person trusting. The person trusting. Because we know all these things that are happening. In other areas, other jurisdictions, you see people really coming out with things that are not helping the society. And then they blow the alarm. But in Ghana, no. My question, I have a question I want to ask. As public health practitioners or promoters, what is our duty? What are some of our duties? What you were saying about the water issue, someone has said it before. And the water the person mentioned I mean, pass the test is Belakwa. That is what the person said.
Yes.
Among all the bottled waters that we have. But the question is, if we have all this around, why are we not coming out to say it? It's disturbing people. Happy. I mean, you go to go to Kolibu, the kidney, whatever, and then you see a lot of people suffering from effect of these things. Why are we not able to, I mean, speak out? Why? Is it because that we are afraid that when we speak out, we'll be victimized, or it is not our duty to do so? So if it's not our duty, then whose duty? Thank you.
Yeah. So it's troubling. Before Dr. Ima comes, let me hear from this hand that was Mr. Eric.
Yes, sir. Yeah, I have something small that I want to add to. I love your lectures when you come in, you give us the chance to talk. The thing is, I started a research. You know, Ghana, we use pipelines going to your house and that stuff. And imagine if the pipe got busted or busted somewhere, and they will call someone who is a plumber to come and fix it. I've seen this on several occasions, and I always look at it and smile. At times, the feces that you were talking about, dog feces, goat, whatever, if the thing gets bust, and let's say in my house, the water is coming to my house, we didn't fix it on time, and the water stopped coming. Hopefully, a lot of stuff will enter the pipe. Are you getting what I mean?
Yeah.
A lot of feces, a lot of stuff will enter. And when the plumber comes, he will cut the end and another end and join it. So whatever gets stuck in that pipe will be there for about 100 years. So our typhoid, whatever diseases that we are having, is not only the lead. And the leaders don't sit down with people who have the ideas. Bro, I did this research 10 years ago. Just imagine that. And it rains. It pulled all the dirt, the trash, and that stuff, and filled the pipe. You wouldn't know it's coming to your house. The plumber will come and cut left and right, hit the pipe, and join it. So when the tap is flowing, you are drinking dirt. You know, kids will go to the pipe and open it and drink straight.
Yeah.
If you go to them and you want to sit down with them and fix it, they will ask you, where is your certificate? That's the first question in Ghana. If they realize you are from Nyakute, they will say, oh, no, I'm telling you, 10 years to come, they will say, oh, the Nyakute people are too much. We don't need them, because they told you, now that you are teaching us, we are exposed to a lot of stuff. You know what I'm saying?
Yeah.
So when they see us, they are going to be afraid of us. I started this first aid program, and that was 15 years ago. I'm the only person who sells first aid. A lot of people sell it, but they don't sell the complete one. And they don't care about the training you do before you can use that first aid. I'm the only person. When you talk to any MP, oh, I want to bring this to Ghana, this. Oh, I can take you to the minister, but I will take 60%. You are taking me, who is coming to do the job, giving me 40 and take 60. You think this will work? So as Ambrose said, all that they know in this life is money. But the Bible says good name is better than riches.
Riches, yeah.
So as for Ghana, as you are saying, we can't get to our destination. every day different thing will come. It's not only Ghana, it's Africa. They don't care. People, when they get to the top, they don't care about those down there. I am EMSI. When somebody say EMSI, I'm not wasting. If I'm wasting time, please let me know.
Oh, not at all.
Yeah,
not
when we
all.
say EMS, you see, in United States, we have the EMTs. When I first came in, I went to Kolebu, I went to Konfanoche. I'm an EMT, US, emergency medical. So I train over there in Nova. But here they don't care. They just don't want to see you schooling somewhere and coming to Ghana because what you are bringing is different. So we have to keep it and bring everything to Nyakote and put it there for people to know. But right now, the paramedics, when they come, even in their bus, their ambulance, the ambulance is not for picking people up. To save life inside before you get to the hospital, but this is to pick you up and do their whoa, they're blowing the siren to the hospital. But in the United States, when the ambulance comes, you can watch the EMTs in when you have DSTV.
Yeah,
you see proper preparation and a lot over it. That is my station. But Ghana, no, if you go, you want to do this, no. They will tell you, you will come, but my cut is 70, you will take 30. What will come in say? So we love to hear from you guys these days. But my concern is the pipe, as I mentioned.
Yeah.
That is where we get the typhoid and a lot of stuff from. Thank you.
Yeah. You're welcome. That's a great submission. Yeah. Okay, Mr. Emmanuel.
Okay, sir. I think much has been said. Actually, much has been said, so we can move on. I actually wanted to also comment on the bottled water. It's not like they don't know.
Okay.
As we've all said, it's not like they know it. Because I once worked with Ghana Atomic Energy Commission. They have a food science department. So I once did some research there. And all these things are people have done PhDs on it, masters on it, and all these research are there. But those other companies who don't even have the good water, bottled water, and the rest are very powerful. Now there's one brand, whenever you mention bottled water, that's the name that comes into your head. But these days, they even show their franchise, and you go to Amazon, you see everybody printing their water. So that's what the way I hate it. In fact, I don't like it anywhere near my house. But it's the most popular brand. Meanwhile, we have Vena, Slim Fit, and then Belaqua being the best with very good pH level, 7.5 to 8.4. Very good pH level. Those three are the best. But the other ones, some people are even Richmond, they are making noise. But if you check their water, boss, it's another story altogether. And our people know that, as we've all said, power and also their cut. So whoever is supposed to check on them is looking at what they will get from them and also how powerful they are. They cannot stop them. If such a rich man is even building hospitals and facilities for the country, how which policeman will go and arrest someone who has already built a hospital for him? Or let me say, I've built a police station for the police. So which police is going to arrest him and put him in the same police station that he built? You can see those people are very powerful and you cannot fight them. And that is the problem we are facing. So that was what I wanted to add. Thank you, sir.
You're welcome. Well, yes, Mr. Amevoji.
Yes, can I? May I?
Okay.
Hello, I'm here. Hello, Mr. Amevoji is here.
Yes, I.
Okay.
Mr. Amevoji.
Okay. Yes.
Mine have to do as naturopaths, learning environmental health. With all what we've said, it implies that we have acknowledged the problems within our environment. How best can we solve such a problem having to do with the water issue? I think way back in our villages, those days we have our pots, we have our coolers made of clay, chalk in our corners, where we fetch our own water, boil it, sieve it, and pour in it. I don't think anyone has come up to prevent us from doing that. I think as naturopaths, we need also to look not only at the problem but the solution. And here, I would like us to delve into how best we can educate our people within our enclave as to how best we can work on our water that we drink ourselves, putting our own health into our hands and into the hands of the individuals within the environment. Because these officers or leaders we're talking of, I don't think there's something that they can do than what we can do for ourselves when it comes to health issues. Because in my language, they said the long life is made by you, the individual. It's just like a rope that you are weaving, and nobody can weave it for you. It is you that can make it yourself. So let us look at the solutions more than the problems. For the problems there, if we are to enumerate it, I don't think we will end this class. So what are the alternatives that we can bring up as a solution? Thank you.
Thank you. Yes,
Thank
Madam
you very
Lucia.
much.
Yeah.
Thank you. Thank you. Yes, thank you so much. I was going to go on that line as well, because in this course we are learning several tools that we can use in order to educate and also to bring evidence. I think for those people who are living those of us who are in the area where there is pollution in the water, we can start to collect data and get evidence. We would need to do the appropriate tests of the water and also of our patients, where we can identify the level of lead in the blood or contaminants in the blood. And then we can document that and use that to advocate against the practices. Politicians understand when people start to make pressure. I also like the comment that was made by the previous speaker, for us to go back to our traditional ways of water storage and not being reliant on the convenience of bottled water. That is a convenience that has been sold to us, and it is not good for us. There is also herbal ways we can put. I know of using moringa seeds in water to detoxify or to absorb pollutants. So let us look at what are some natural ways that we can use to purify our water, taking our health in our own hands, as was explained by the previous brother. Thank you.
Thank you, Madam Lucia. That's interesting. Mr. Eric, your hand is up, or is the old one? Okay, I think it's the old one. Pastor Henry, your hand is up. Is it the old one or?
Yes, sir. Okay. It's the old one.
Okay.
Thank you, sir.
Madam Lucia, are you from Zimbabwe? Am I getting the name right? Madam Lucia. Okay.
I'm sorry. Yes, I'm from Belize. I'm not from Zimbabwe.
Oh, okay. Oh, okay. So Belize, that okay, you are two here. That's great. That's great.
Yes, I'm trying to bring my hand down, but I had to change my device because we had a power outage. and so
Oh,
I'm not familiar with this. But
okay.
I'm through. Thank you.
You're welcome. Okay, that's great. That's great. So the challenges are there, and lawyers and their technicalities. If you go and say and you don't say it well, it becomes problematic. And as natural, I mean, medicine science test, you'll be called to, I mean, come out with the the law or the scientific research that supports your claim. And the way they will massage the law against you, you regret. So just as you said, Mr. I mean, what you said, we can begin something. Now we know the challenge, and you know that the challenges of public health can become opportunity for naturopath. So if we can go out and say, at least they come to us, they will come in front of you, and then you educate them, not necessarily trying to speak bad of someone's business or someone's company, but try to project as much as possible the good ones. Okay. And then when the person takes it, it becomes fine for the person. Okay, it becomes fine for the person. Okay. So we've all done well. That's great. That's great. So we all know lead exposure. These days, lead toxicity is everywhere. Lead toxicity is it's not easy. It's not easy. It can lead to rapid deterioration of your blood cells, your red blood cells, leading to anemia, can get reproductive problems, cardiovascular effect, reduced kidney function. All these things can come as a result of what? Lead toxicity. Okay, now let's look at how to reduce potential exposure to lead. So how to reduce potential exposure. We are saying that as much as possible, keep products containing lead out of the hands and mouth of children. So you keep them out of the hands and mouth of children. Regularly wash children's hands and their toys. Okay. You regularly wash their hands and their toys, you know. And then you mop your floors and wet wipe your window seals every 2 to 3 weeks. Okay, every time. So I mean, the last is to prevent or reduce access to lead-based paint that is peeling. Okay, so I mean, it's essentially boils down to one thing: cleanliness. Okay, cleanliness at every point in time. You should be mindful of I mean, cleanliness, and then it will be fine. Now, what are the main routes of exposure of lead? We have household environment. Okay, the household environment, as is seen in our paint, as is seen in our uh, um, 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 I mean, lead containing compounds or items that are in our environment. Okay, it is also seen in our water, just as we are saying these days. The tap water will be flowing. Oh, it has burst somewhere before they repair. The things have entered cry, and the things that have entered, some can stay in there, and the water will be passing over into our and then flowing into our this one. So it's not easy. We are really in trouble. Okay. And it can also come through the air. Can also come through the air. Okay, let me read well. Particular, okay, let me read it well. Yeah, so particular movie, and it will help us a lot to rethink and restructure our minds. The Arrow by Oliver Queen. The Arrow by Oliver Queen. So thank you. We'll try to watch it. We'll try and then search out on YouTube and then see. Okay, so these are the real dangers that we are having real dangers, okay, in our environment. Now, preventing chemical exposures. Preventing chemical exposure says we are exposed to thousands of chemicals every day through our food, through our drinking water, through the air pollution and consumer products. In fact, one news I watched was saying that India, in the Western world, US and the Western world, and then especially the Western world, they make a lot of waste, I mean, pollutant, air pollutant from their factories and then this one. And they're able to direct the wind in such a way that they look at the wind that is blowing towards the south here, Africa, and they release it along that line. So even though we are not really an industrialized nation, we bear the consequences of other nations, this one. Okay. And so this is the challenge we are having. When you watch the news, sometimes you watch India, then the news that are coming from the videos and this one, you can see that from the video they will show you, yeah, air quality sometimes is really something. Okay, it's really something. The air quality, when you look at it from the atmosphere, like people are really breathing something, and it is not helpful at all. It's not helpful at all. Okay. So it says that communities often are unaware of the threats of chemical exposures and the potential health effects may be unclear. Most often, we are not able to educate the linkages between the health, I mean, the impact of these things on our health. Okay. Yes, in India is very bad. India is very bad. Okay. They have a lot of pollution in the air pollution. Okay. So by educating the linkages between the what environmental hazards and our health may also help. Usually what I have seen is that when individuals are in their optimal health, when they really have good health, they are not really mindful of what you say. That is where I don't know, but that is what I have experienced. When they have the health, what you are telling them doesn't really make sense until a disease sets in. So we can capitalize on that. And those who are coming to our clinics, those who are coming to us for consultation, we can what? We can be teaching them, we can be guiding them, letting them know that this thing must have played a role in this one. Yes, yes, pooping outside, natural air condition. That's the term for natural condition. So they just find themselves in a place and then the air will be blowing past their body and they are okay. Okay. Not knowing that it is taking their this one to someone. Okay, it is taking their this one to someone and it's not something really nice. There are some people they are poop and when they poop, the whole community must run away. The In fact, not even the whole the whole town, the whole district. Okay, the scent that is coming. Okay, we just can't stand it, and they are okay. They are okay with that. Okay, and if care is not taken, and then you are sitting in a public transport with someone like that, and then the person releases air. And see that air, when it is coming, it doesn't make noise. It comes very cool. Yeah, it is. No, normally the dangerous things do not make noise. It comes very cool, and sometimes it is hot. Yes. And then you are not having breathing space. You are telling the one sitting by the window, open the glass, just open the glass. The person said, I'm feeling cold. And you are in the middle. You don't know whether to raise your nose to the sky, whether to turn to the left, whether to turn to the right, whether to even seal your breath. Hey, we suffer in this country. And sometimes not only the air. In fact, some time ago I was coming from Dodowa to Accra. There was no car. Luckily, I got one. And the mate says, sit on my seat and I will stand. What? The scent coming from the mate, I'm sure that the whole of 2025, he has not bathed. And I sat by him from Dodowa to Accra. As soon as I got down, I had cold. In fact, I was not even feeling my nose. Small time, I'll touch my nose and see whether my nose is still there. It is not easy. But you get down and see whether you get car to where you are going. So you have to manage. This is the situation, you see. So it is not easy. Yes, it's not easy. It's not easy. But sometimes, I mean, we are managing. So environmental factors that affect our health. Okay, the chemical safety, air pollution, climate change, and natural disasters. In fact, today I saw one post on our page. They said by someone. Yes. So you see, these things are there. Oh. They are there. You see, and the person says that, in fact, I don't want to make it look like I'm saying something so that before you realize, among the students, there's a national security. Before you realize, national security is among part of the students, and I'll be in trouble. So let me just quote what the person says. He says that by one this one says, I worked at Pfizer for 17 years. We didn't discover drugs, we discovered markets. If a drug cured asthma in 3 days, we will kill the drug. Chronic disease is where the money is. Cures are bad for business. Me, I'm reading. Oh. I've not said something on my own. No, I'm reading. See, many the whole rough before you realize. As a matter, and you can't remove your mouth. So, in fact, these are all chemicals. So, based on what this man is saying that he has worked in Pfizer, so the man is saying, based on what he is saying, if he's lying, so I'm lying. Based on what he's saying, what it means is that even the drugs that we are drinking, I mean, it is problematic. That is what the man is saying. That's the interpretation. In fact, let me even forward it to you so that you see that what I'm saying. Okay, I'll forward it to you so that you see what I'm saying. That I'm not saying it from my head. Okay, so this is the problem we are facing. This is the problem we are facing. Now, some time ago, I learned that the king of United Kingdom had gotten cancer, and he says he doesn't want chemo or radiation. He will use herbal. We have waited that the man is not dead. The man is still alive. So it means that the herbal have done something. So it means the herbal can do something. Okay, I'm just making deductions. So I'm just making deduction because we are waiting long time for him to die. He's not dead. He's healthy, working, and he rejected allopathic this one, and he went to Heba and he's still alive, then it is insinuational. So this scenario, think for yourself. Just think for yourself and then make your own deduction. Me, I've understood mine. Okay. So yes, so climate change and natural disasters too are there. Diseases caused by microbes. Okay, lack of access to health care. I think as for Ghana there, I mean, we are really getting on board. I'm praying that our leaders will be able to finish this agenda 110, and then I think would have made great strides. And even as we are coming, those of you who have money, me, I don't have money. Me, I'm broke. Those of you who have money and you are establishing your own facilities, you are also in the primary healthcare setting. Okay, you are also helping. In fact, you do know that research says that 60% of all disease conditions, they go to Heba and the natural alternative practitioners as their first point of call. Okay, 60%, as much as 60%. Okay, so you can understand. We are all part. In fact, I'll not say we. You are all part. Those of you who have money and you are establishing your own this one. You are all part. You are helping the problem that we are having. Okay. So that is it. That is it. So now let's go to chemical safety. Okay, chemical safety. So we are saying that different chemicals can impact human health in different ways, and often exposure to dangerous or foreign substances creates health vulnerabilities. Okay, the chemical safety field is concerned with minimizing the effect of both natural and synthetic chemicals. We, as much as possible, minimize the safety. One lady talked to me yesterday, and she says, for the past 3 years, she's been diagnosed of enlargement of the heart. In fact, specifically the left atrium. Okay, and then the left ventricle too have become stiff. So he's having diastolic problems. It is unable to relax and all of them. He has been on medication for 3 years from the Kolebu cardio. So I asked her to mention the drugs that she's taking for me, and it was pathetic. It was pathetic. So I told her that why don't you report to the doctor? He says, I've reported. The doctor said, this is all I can do for you. This is all I can do for you. This is what I can do for you. Said, hey. And she said she changed to Heba. She did the Heba for I think 1 month, getting to 2 months, and come and see their family members. Stop that, don't take that. The doctor said don't take Heba. The doctor said don't take. He said, me that I'm taking that thing, I feel better in my body than taking this one. Why is it stop? And she has to stop. Because if she doesn't stop, those who are giving her money to buy the grass, they don't give again. Okay. So this is the problem we are having. This is the problem we are having. So we are sick, we go to the hospital, and then we end up introducing more toxins in our body. In fact, that is what the person is saying, you, not me. If you want the number, I can give it to you. Yes, Madam Ingrid.
Yes, I wanted to speak about that, what you just said. Of mine, I think I might have told a story in class. He had prostate issues for 10 years. And the reason why his wife mentioned it is because he was getting more pain, wasn't getting any better. He was having more and more pain in his waist and all of that. And there's a tree that I know of. Well, I didn't know she had the tree. I told her if she could find that tree. She said, but I have it in my backyard. I said, what? Well, there's your medicine. So she went, prepared it, and in 2 days, pain, and he was free in his process. He was peeing like a cow, and he threw away his, I won't mention the drug, but that was taking 10 years and going to the doctor, I think every month, paying for this thing that was not doing anything to improve his health. All it did was to try to manage it in the beginning, but it was getting worse. It was getting worse and worse till he was in so much pain that he could hardly walk sometimes. And in 2 days, it was gone. So yeah, I'm a strong opponent. I know in this class, one has to be mindful of using scientific methods and, incorporating the orthodox and all of that. And yes, we'll incorporate it where it can. But I strongly believe in my herbs. Thank you.
Thank you. So this is what Madam Ingrid is saying. Oh, so it's not me. Oh. If there's any question, you have to ask Madam Ingrid. Mr. Joseph, yes.
Yeah. I'm working with SDA Hospital, Sunyane, as a counselor. And one time someone was having a problem with asthma. I think it's a genetic. So because of that, one of his brother tried and died. And he been going to hospitals several times. There wasn't any improvement. So one of my church members asked him to come and see me, so that I can help the guy. And lo and behold, I prepare medicine for the person, and by God's grace, within 2 weeks' time, the asthma is gone. And up to date, about 2 years now, there is no more any attack. Thank you.
Thank you. That is what Mr. Joseph is saying. Oh. So if there's any question, please go and ask Mr. Joseph. Oh. They have not said anything.
Yes.
So, Mr. Joseph, after this, do you intend to work at Sunyani still?
Yes, I intend to work in Sunyani because I'm now 66 years.
Oh, okay.
I've been retired.
Pastor from the Seventh-day Adventist Church.
Oh, okay.
Yeah, so they want me to serve in a contract basis. Yeah. So I'm preparing my place here, and if God permits, I will work here for the meantime, and later move to Kumasi because I'm having my own house at Kumasi. And I have my own house here on the roadside, which I can use as a clinic.
Okay.
Yeah, and also asthma. I have a plant, not asthma. This disease, ulcer. I have a plant. You just chew it. Within 1 week or 2 weeks' time, it's gone. You'll be free. All the H. pylori that are worrying you, you go to lab and have the test. So the laboratory men over here, they know. So if you have any problem, they will ask you to seek literature. Go and see Pastor Boateng. He will help you. So they know. The areas I don't have, they are aware.
Okay.
So they can ask you seek literature to go and see me. So when you come and see me, and the plant medicine is working. It works. It works.
Okay.
Yeah.
We thank God. Okay. Mr. Ambrose.
Yes, sir. Thank you. If we are to talk about this planting, I think we can use the whole day or whole week and we will not finish. But one thing I've realized is that when the white man in so many decades realized that the plant in Africa was working the magic or the miracle for its people, they decided to send forth chemicals for destruction. I remember last year, Prof. Nyakutu posted something on our platform that about 6 regions in Ghana, there's been a research, and about 6 regions in Ghana, the contumely that we consume a lot and is very medicinal for us. are having heavy metals. Like they are, let me say, they are poisoned in 6 regions in Ghana. 6 regions. The rest hasn't come yet, so we have no idea. And look at in our olden days, when the farmer plants maize, he picks up the healthy ones for the next harvest. Now, when you plant, when you go to the agro shop and you buy from them and you plant, in your next harvest, the same maize, if you plant, it won't grow up unless you go to them and buy again. All because of these chemicals, weedicides, pesticides, whatever side, put this on for 3 days every week. Put this one on, spray this one on. When it's flowering, put this one on. When the fruits are young, put this one on. Before it ripe, put this one on. Before you have it, so everything has been chemicalized. And even in our homes now, Ghanaians, let me say most Ghanaians, about 80% are lazy. Even in our homes, we don't weed. We only spray. And you see, the white man has told the black man that if you want to hide anything from the black man, put it in the book. And this same white man has told us that when the last tree die, the last man die. And they have given us chemicals to spray on these plants. And the same white man told us in research that we breathe in and out, we breathe in oxygen and breathe out carbon for the plants to take the carbon and give us the oxygen. Now, so when you spray chemical on the plants, what oxygen do you or are you expecting to breathe inside you in your own house that you have sprayed? Not to talk of the farm. In your own house that you are not weeding. The plants that you have sprayed chemicals on, what oxygen, proper oxygen, are you expecting the plant to breathe out for you to take in? Which means automatically they have given us that power to kill ourselves. But I've even texted something in the text box that like the blacks or the Africans are not united. It is the white man that splitted us with language and religion. Now we are naturopaths, we are Africans. Most of us are, let's say, about 80% are Ghanaians. Yet whatever we are teaching here, we are using English. So in the end, what happens? Yet we are advised to teach our people in our local dialect. Yet we are being taught in English. So at the end of the day, you still have that same old slave mind of English inside you. When you speak the local language, like Mr. Ameboji, the last time we were doing group discussion and one of our presentations, he decided to speak Twi. He translated everything to Twi. Sir, you will love it. You will love it. Even though I think people from Belize and Jamaica were on, they didn't understand. But they also loved it. They didn't understand though, yet they loved it. So if something huge can be done, I think we should go back to our Kaboland, back to nature. Whereas we don't give much credit to the hypocrisy and one, but we refer everything back to Africa. And then we will go. If not, we will run, and still come back to grammar and nothing will happen. Thank you.
Thank you. You're welcome.
Please, my hand is up again.
Yes, Madam Teresa.
Yeah, good evening again. I also experienced something like I gave a medication to a judge on post-treat, and he's got a good result. He went to the hospital and told the doctor that my niece has given me some herbal thing and I've been so relieved of this post-treat. He said, oh, we know some of these herbs are very good, but some too are not good. So when he came back from the hospital, he came and told me that I should quickly go and register with the TMPC. But what he said was that the traditional herbal. Then I said, me, a pastor, why should I go to the traditional herbal? He said, go. I know what I'm saying because doctors go under an umbrella. So when they do operation and somebody dies, they are covered. So you to go under that umbrella, because if you are not there, you may get into trouble. That caused me to join the TMPC and had the license to do this herbal thing. But just recently, that is in August, somebody came to me, a man about 60 years old, and he said he's been having this postrate. He's been visiting one of these well-known postrate hospitals, but his level was 81 for a long time. So I just gave him the medication I gave to my uncle Judge. And then within August and November 2024, the level dropped from 81 to 47. And I know that by he being 60 years, if the level gets to 35, 40, then it's normal for him. So he's on the last medication. When I go back, we'll go and check, because it's only 7 to get to 40. And you know, people have got names, hospitals, but they are not helping people. He came to me, but now he's so rejoicing. He said, he's wasted a lot of money, many years over there. But now, just within the 4 months, he's up to this level. So you see, we have something with this. We have to actually go forward and use it to treat people without fear. That is my contribution. Thank you.
Thank you. Thank you. So, we'll move. We'll move. You know, one day things will be fine. Yeah. Focus. Yeah. So we are still on chemical safety. And we are saying that public health officials who work in chemical safety often, they often focus on toxicology, toxins, how these toxic substances affect our bodies, and then all of them. So all the chains through which this passes into our bodies. Normally that is what they focus on. Now we consider air pollution. And so we are looking at environmental factors associated with disease. And the first is what? Air pollution. So we are saying that in 2013, the International Agency for Research on Cancer of the World Organization classified air pollution as a human carcinogen. And we are saying that WHO, according to WHO, air pollution effect on humans are significant. So, for example, 29% of all global deaths result from lung disease, and 24% of all global deaths from stroke, 17% of all global death and disease from acute lower respiratory infection. So you can see that according to WHO, 29% is really significant. From lung diseases alone, it's really, really significant. And I think it is the second. Respiratory problems is the second on the ladder now, just behind cardiovascular diseases. So we know that there are two main sources of air pollution. We have one that is man-made and one that is natural. So let's look at the man-made or human-made air pollutions. We have the one that is coming from vehicle emissions. Then fuel oils, natural gas to heat homes. These natural gas that is used to heat homes, Africa, we are not really. Then we have byproduct of manufacturing and power generation, fumes from chemical production, volatile organic compounds are given off by paints, cleaning supplies, pesticides, furnishings, and even craft materials like glue. Okay, so these are man-made or human-made air pollution that we have. Then we have the natural sources. So wildfires, okay. We have volcanic eruptions. We have like methane, gases like methane, which are emitted from decomposing organic matter in the soil, pollen, and mold spores, often linked to asthma and allergies. Okay, these are natural. Usually they are natural. Okay. Then we have diseases that are caused by microbes. You have air pollution, environmental factors that are associated with disease. We have air pollution. Now we are looking at microbes. Okay. We are saying that trillions of microbes. In fact, research shows that our body is more animal than human because we have more animals. We have more animals in us than human cells in us. Okay. So we are saying that trillions of microbes exist within the human body, and they also live in water, soil, and then air. Okay. Yes, use closed. Ofos. Ofos. Brony well. It's not easy. So they are dumped here in Africa. Plenty. Okay. So the microbes, we can have bacteria, can have viruses, can have fungi. Okay, they are all there. Then harmful microbes. Okay, some are friendly, some are in our bodies. They help us. These microbes, microbes. Some are in our bodies. They help us, but some too, they do not help us. Those that do not help us are usually called pathogens. Okay, they are usually called pathogens, and can affect us in many ways. Okay, some live in the soil. Okay, some are in the air, and all of that. So let's see. So another factor that is associated with disease is lack of access to healthcare. Lack of access to healthcare. I think for our territory in Ghana, here in Ghana, we are making progress, and very soon all of you are going to come on board to also assist in the process. Okay. Then infrastructure issues. So our roads, yes, Ghana, we are moving, but we still have a way to go with our roads. In fact, in the cities, I think it is becoming better. Like when you go to the villages, especially when it's a main road connecting two communities, the dust that can come, and then it is really worrying. Okay, really worrying. Clean water, yes. Clean water sometimes becomes a challenge in some communities. Okay. Poor water quality. We've taken care of this. I mean, we've spoken at length of this. So now at least we can take some lessons from the water we are drinking. Industrial hygiene. It's a problem. Industrial hygiene. These days, the emissions that are coming, it is not easy. Okay. Plastics and all of them, polythene bags. Okay, all these things are from the industries, and they are really harming us. Okay, so essentially, these are the things, the factors from where the environment can feed us with disease. Okay, these are the areas that the environment can feed us with disease. Okay, at this point, we are done. Any question, suggestion, contribution? Yes, Mr. Amevoji.
Thank you for the opportunity. I would like to seize this opportunity to invite those of you in the industrial areas to pay visit to the Volta region, if necessary, relocate to Volta region. because now in Ghana, it is the only oxygen-rich tea that you can get. So I'm inviting you to Volta Region. Come to Volta Region.
It is
Relocate.
true. It is
Those
true.
of
I'm
you
enjoying
abroad,
the air here.
those of you abroad, come to Volta Region. You enjoy the air, you enjoy the natural water.
Yes,
Thank you.
yes,
You are all
thank you.
heartily welcome. So, Doc, Dr. Prince, relocate to Volta Region. And from afar. Thank you.
You're welcome. Yes, it's true. If you want one of the purest, I mean, it is water. That is very true. That is very true. Water and no tea. That is very true. You know, the problem we have is Greater Accra, Central, Eastern, Ashanti, Western, you know, those in the coastline and then those in the eastern part of Ghana, Eastern, that is where the problem is. Mr. Chambon, what you have written there, I can't say. Well, well, okay. So yes, yes. Any question, suggestion, contribution, so that we can. Mr. Eric is saying the tupi, the tupi. I know Volta is a wonderful place. Seriously, Volta is a wonderful place.
You see, it's not in everywhere. I have gone to the middle of the Volta on the Hawkwell Road. I'm enjoying the breeze, the coolness, and peace all over there. That's why I haven't come back to Accra yet.
So you see, yeah, it's a wonderful place. It's a wonderful place. Oh, someone is asking what tupe is. Tupe. So, Madam Lisa is
in
asking
English,
about.
you say voodoo. In English, you say voodoo, or someone will do. That is if you commit a crime. If you go and offend someone, then the person will also harm you spiritually. Basically, that's what it is.
Yes, spiritual bombardment. Yes, like voodoo. Yes, like voodoo. They will voodoo you. So in Volta, you can leave your phone anywhere and then go and come for it too. Because if you try. Okay. Any more suggestion, contribution? Okay. So I can see we have all understood.
Hello, sir. Hello, sir.
Yes.
Yeah.
Mr.
So just like no, this is Ambrose.
Mr. Ambrose. Okay.
Yes, sir. Yeah, just like Mr. Eric was saying, you know, this thing, for me, I'm not a Voltarian though, but I would say that gone are the days when where we have these natural spiritual beings operating. I believe they were less evil, they were less bad things. You can leave, let's say when your phone falls down somewhere in the Volta region, you go and come and meet the phone. You can open your door, nobody enters. But in Accra, a church that is locked, people will bring a car and load the church instruments away. Because I would say that there's no spirituality in the church. But in Volta region, on the streets, when somebody's money fall down, you look for the owner. Because you can't mess up.
Yeah.
So this is the African belief. This is the African God. Sometimes it's so pathetic that yes, I believe in. I'm a godly person. Sometimes I tell people that I'm not a Christian because Christianity came to meet godliness. People before Christ came, people were serving God. So I serve God than serving Christ. But people don't understand that one. You will not preach it here. Now, one thing I know is that people have turned Christianity into something else. So at the end of the day, the spiritual awakening of the let me say religion is missing. So a whole minister will hold the Bible and lie, to swear and lie. Next 4 years, you hold the same Bible, swear and lie. Let's give them snap, egg, or bodia, and see if they will lie. Sometimes, people need extra forces to preach. You go to there's this town, I've forgotten the name, in Sunyani area. It's one of the biggest cities in Ghana. Who made it? Is it not human being? When it comes to Asen, there's one there. Who made it? Is it not human being? And other places, you go there when they are being voted for as one. The next 4 years, you will not see even their shadow. But when the 4 years are approaching ended, they will come back begging for that. Oh, I didn't do well. I know I didn't do well. You wait for me this time, I'll come again. Until they lose money. And nobody is holding them accountable. A young man who is hungry will steal cassava and he'll be jailed 5 years. Somebody, big man somewhere, will steal a lot of money and will be giving lawyer, and the issue will be up and down for so many years. The person will be free. So more or less, Ghana. Like I remember some years ago. If I should tell you the kind of people I've treated before, you'll be surprised. Of course, I didn't have much certificates, huge certificates. So where did you school? Where's the certificate? Where is it? There's one hospital at, let's say in Accra. No, this hospital was collapsing, and I had the remedy to. I went there, and they were asking a lot of questions, certificates and this and that. No, this one is not done in Ghana here. This one is in China. This one is in America. Why are you doing it in Ghana? A whole lot of questions. At the end of the day, as it stands now, I remember there was a day an auntie was sick and was admitted. So a hospital that somebody was admitted at 8 o'clock. The person was discharged to go home. Why? Because there are a lot of mosquitoes. If you sleep here, you will be worse. So go home. Tomorrow morning, you come. Person on admission in a hospital. And the nurses will advise you. This is the same hospital I wanted to help some years ago, and they refused. Now it's collapsing. And none of them, they just asking questions. And those who have the PhDs, who have the masters, the degrees, the whatever, are just reading. They are not practicing to us. This is the problem. We pray that some of us here from Nyakote, when we come out there, we will support Prof so that whatever he's doing, with the little he's doing, people are against him. But when we come to support him, it is really going to help Ghana. That is why they don't want to help the alternative medicine practice to pass a bill. Because they know when they pass that, there'll be trouble. But we pray that one day very soon, they will pass it, and then we join hands with Prof and other people to, and elevate all these things so that peace will reign. Thank you.
Thank you so much. Thank you.
Hello, Bob. Good evening.
Good evening.
Thank you very much for this topic about head public. But I think we are mixing some words, and the character of the people is a different form. Sometimes maybe we condemn the religion and Christianity. The individual person behaving, somebody can sitting on the church in 10 years, 100 years, if you not decide to change, allow the God ways to direct you, he can behave in anywhere. If you put him anywhere. But the issue is that the character about the black person always want to take advantage. And advantage that because of the poverty that we beginning as huge in our life, if we get any opportunity, we want to take two hands to take everything at a time. That is our problem. Because if somebody will say that you do in a voter region, I know the friend of the judge and a friend of the police, one of their comfortable zone that if he opposed to you as a judge on the voter region, there's no innate that still community that we are saying we are serving God. Those we are made with us. So now we have a fetish priest and other things that do so many things in their work, in their community. The people don't know. We saw what is happening there sometime in the news, what is done in so long that one day the light will thrown on him. So if you want to tackle the issue, you are tackling the issue about our lifestyle, the way we are living, and the way people want to take. For instance, about even last week, there is a doctor who working in the voter region side, using the government ambulance, loading the trucks onto the city. And you saw this man, he say he be in the elder of the church. He have his own character that he used as a wolf in the church. But let's talking about the individual, what he are done in the dark. If you are talking about the pollution, those who are selling in the market are dangerous, those who are being the money. The way they are polluting the food we eat and selling is very dangerous. So I believe in that. Now we are seeing the light to get that opportunity because the place that you can get more people in the church, mosques, and the place that you can get people in the public, if you are doing your health exercise, you need to give the education to the people. And the churches must be started it from somewhere. And your community to volunteer and people, the awareness will come gradually. And I believe in that as goes on, it can reach in many places so that the character of the behavior of people might be changed. Thank you very much, sir.
Thank you so much. Thank you. Mr. Mevoji.
Thank you, sir. I would like us to look at as we consider environmental health, the food that is being prepared nowadays. There are a lot of these imported products that are being added, and they are very injurious to ourselves, our children, more especially when it comes to the sweetening. Because now I'm told many people are not even using sugar, but they are using jolly juice. They just drop a little in water, and it is so much sweetened. And we know all these are coming. The Magic Cube, the cube and others. Now you go and buy even common kenke. They add cube to the pepper they have grounded. They use cube when they are frying the fish. These are all coming as environmental health. My question is, what can we do to reverse this situation or to mitigate this occasion? What can we do as Metropass, as public health practitioners, to mitigate these negativities in our environment? Thank you.
Thank you. Thank you. We shall come there. It's not easy. Property is broad. Okay. Okay. So I thank you all for your contributions, your support in this. So we've come to the end of the third week, and God willing, next week we are going to meet again. In the absence of any question, suggestion, contribution, then we'll have to say Yes. Yes. Yes, that's true, Mr. Rick. So may the Lord be with us until next week. Bye-bye.
Bye.
Thank you.
Bye,
Thank
sir.
you. Thank you.
Bye. Bye. Thank you, sir.
Doc, I'm looking forward to see you both in your dog.